As a clinician, actually most of the time we are more involved in clinical works, day-to-day running. We do a lot of trainings and things like that, but we hardly do any clinical research. More specifically, aesthetic medicine, clinical research, and in Malaysia. So for the very first time we get the opportunity to do this, I'm really thankful that we are given the opportunity to be in the first batch to study how to do clinical research. So as clinicians, you might want to actually look into it so that we can go to another level. Okay, so among all the topics that I went through, the topic that I like most or beneficial to me most is about methodology. So for the very first time, we sort of like go back to med school and think about all the studies, clinical papers and things like that. Are we studying something new, or is it something experimental? Is it randomized? Is it an observational study or experimental study? So we get to know that actually sometimes we can, a lot of time we think clinical research as very big, all these RCT trials by all the big drug companies involves, thousands of people and a lot of budget. But you can, as a clinician, in our simple practice here, we can even do certain studies like observational studies. For example, you have an interesting case, you know how to do a case report. You can do a series of case report. You can do other studies which are more grouped into observational, and this is really interesting. I find it like we can start even by today. And during the course, we are doing some clinical studies on acne management using monotherapy IPL. And during these case studies, I find that it's very nice because our supervisor actually really guided us, gave us the parameters, gave us how to do, and actually observed us, almost like hand-holding for a lot of us. Okay, but the team is very diverse. We have clinicians, we have people from the admin side and things like that, and we work together, and it's very nice. And even people from the vendors, from the companies. So I find the teamwork very helpful, and it sort of gave us confidence to do the experiment. And I think big shout out to all my teammates in the first batch. We had a really good time working together and really enjoying the learning process as well. And I would highly recommend this to all the practitioners, all the aesthetic medical practitioners in Malaysia. There aren't many studies done in Malaysia, more specifically, I mean related to aesthetic medicine. And we could be in the forefront, we could be the one that publish papers. A lot of vendors are actually just waiting for us to join us, really there are already inquiries. At the same time, I also look forward to be teaching in this course as well. So do join us, and see you soon. Thanks.